I would like to go back to another video witness now at this point, Dr. Malcolm. I would offer in evidence the video of Dr. Phelan as Exhibit 1B.
That's fine.
And at this point, I'll go ahead and offer the exhibit of 1C, but we'll wait until the video is finished, and then I'll offer admittance of it.
Very good.
Dr. Phelan, or Dr. Malcolm, sorry.
Our next speaker is Dr. Matthew A. Malkin, a PhD. Did you pay $1,000 for yours? Professor at the UCLA Department of Physics and Astronomy, a 25-year accomplished astrophysicist with expertise in the scientific method and the conduct of rigorous science and scientific research. He's a recent independent critic of the PM epidemiology and science used by CARB. Dr. Malkin.
Thank you all. Thank you for coming and listening. Try not to make this too geeky. The guiding principle that CARB or any powerful autonomous government agency has to follow here is the more costly the regulations, the higher the degree of scientific certainty required to justify them. The CARB new diesel regulations are going far beyond what any other of the 49 states or the federal government is doing, but there's no scientific certainty about the basis of it. The claimed toxic effects of the diesel particulate matter are hundreds of times smaller than, for example, the increased risk of lung cancer you get from cigarette smoking. These possible effects are the smallest that have really been studied in medical history. The exposure levels are so difficult to estimate for different people. There's so many confounding health factors like smoking and lifestyle that are not controlled in these studies. The whole question needs to be reassessed before adopting a radical crash program against diesel engines. I've tried to take an objective look at this scientific question. Is fine particulate matter in diesel exhaust causing cancer and premature deaths of a measurable number of Californians? The short answer is we do not know. Now, I have no professional no personal stake in the answer to this question except that I'm against abuse and corruption of science. That's it. Fine particles are the first pollutant that I know of which lacks any definition of what it's made of. Some of it is hydrocarbon residues from all kinds of combustion, but much of it can be almost anything. Specks of dirt to airborne sea salt. CARB's original justification for targeting fine particles, that means the PM, the particles that are smaller than 2.5 microns, was that they could be carcinogenic and cause lung diseases. But the research that CARB relies on failed to find any statistically significant increased risk of any form of cancer or any lung diseases associated with fine particles. It's a classic bait and switch. So instead, they started hunting around for new correlations with a much more amorphous but very large category of deaths due to heart disease. That's a big killer. There's no clear medical model of how the heart disease would be caused by the diesel particles. Even in the studies that the CARB advisors choose to put the most weight on, those are the ones that they're co-authors on, the claimed association between the fine particles and the premature death. Any death of them before age 75 gets counted as premature. 74, it's premature. The range of results that they like are barely significant at the 95% confidence level. The physical sciences I work on, you could not get that published. You need a 99% confidence level that none of their studies even has. We still cannot confidently rule out the possibility that diesel exhaust is statistically associated with 0 premature deaths. It's a very small number, could be 0. I'm going to give you 3 technical reasons why we don't know this, but I think everybody in this room can understand these problems, the fallacies. First one, fundamental problem is that the studies did not compare matched samples of people in the high exposure areas and the low exposure areas that has less diesel particles. An example of this fallacy, it's a serious one, is poor people are more likely to live in more polluted environments than affluent people. Poor people are also more likely to suffer premature deaths. Those correlations do not establish a causal connection. They don't show that it was the pollution or the diesel exhaust that caused the higher rate of premature death. It's a simple fallacy. There's only one study that even tried to deal with that, and it really didn't succeed in sorting out the differences between the exposed population and the less exposed population. Why? Well, I could tell you one problem. The study found that people with there was no harmful effect of the particles for people who had some education beyond high school. You think the particles knew if those people had gone past high school? Of course, what happened is that the more highly educated, more affluent people probably had healthier lifestyles, and that was the reason, not diesel exhaust, for their slightly lower premature death rates. The main finding that study is resting on, just to get real specific here, is that there was a 26% higher rate of premature death in the heavily polluted city of Steubenville, Ohio. That's the red splotch on Jim Enstrom's map, compared with the unpolluted town of Portage, Wisconsin. But, of course, this could be explained by even just a slightly healthy lifestyle in Portage, Wisconsin. We really don't know if they're healthier there or not, if we ship them all from Steubenville and change their lifestyles. But even if you do accept the flawed studies without considering any of these problems, they still don't give you a clear answer. This possible correlation between diesel particles and premature deaths is so small that the previous studies could not measure it confidently. CARB's favorite study had only 8,000 subjects in it. It's a total. Then they extended it for another 8 years. This is a red flag. The significance, which was very marginal to start with, did not improve at all, even with a larger amount of data. In fact, when you included the effects of sulfate emissions, there was actually no harmful effect found that you could pin specifically on the fine particles. The American Cancer Study, that's their second favorite study, exactly the same story. Big increase in the data set, no increase in the significance. It's this close to not being significant, to not being publishable at all. Really just a matter of how you call the line of significance. But anyway, there are a lot of other studies that Dr. Enstrom has worked on and many other people around the world have worked on, which found no effect whatever between the fine particles and any health effects. 4 out of 5 of the CARB studies that they considered showed no effect. How you weigh these things is really just a subjective choice. And so the CARB advisors basically chose to ignore the ones they didn't like. They cherry-picked the studies that happened to support the position they wanted to have. So that's why they wouldn't admit the fact that if you look at the totality of all of these studies, it's still consistent with the possibility that there is no effect at all of fine particles leading to premature deaths or other health effects. Okay, but even if there is a very, very small claimed effect, actually Dr. Enstrom showed some studies that the amount of effect we're talking about is a 1% increase in your relative risk of dying prematurely. That's the kind of level we're talking about. But it in no way justifies the draconian crash program that CARB is going to subject California to. CARB data itself shows that the fine particle levels are dropping across the entire state rapidly. In only 3 years, it's gone down 25%. By 2006, the most affected region, Southern California, South Coast, had fine particle levels which were only 50% higher than what's measured in the Mojave Desert and the mountain counties. Thus, most of the problem that CARB is attacking will already have disappeared before the regulations take full effect. The regulations are going to require the expenditure of billions of dollars. Now, it's an iron rule of public health that making people poorer results in their being less healthy. So one thing we know for sure, the research is really is very murky about the fine particles. It's a very small or zero effect. But one thing we really know that will knock off a year or more off of your life expectancy is losing your job. There's a health effect. Thus, this is ironic. Even if the proposed these CARB regulations do end up preventing an unmeasurably tiny number of premature events. They throw numbers around just for fun. 200, 300, 700, whatever, out of millions of deaths. It's unmeasurable. Still, it will probably be overwhelmed by the negative health effects of their regulations. So on balance, this CARB crusade against all diesel engines will likely decrease the overall health of Californians. So, thanks. That's all I wanted to say.
Hearing officer, I would now offer that as Exhibit 1C.
Yes.
Okay.
So accepted.